Sure. I'm Brian Buckley. I'm a second year medical student here at Upstate, and I'm from Levittown, New York.
Okay. Farah?
All right, I'm Farah Dakar, second year as well, and I'm from Haiti, and I lived up here also.
You do. Nate?
Hi, I'm Nathaniel, and going along with the theme, I'm also a second year student here at medical school, and I'm from Lowell, New York.
Very good.
Marvinia Charles from Upstate University, second year medical student, and I live in Long Island, Elmont.
You do. Very good. And Cloudy?
And my name is Claudia Zolme, and I'm a second year as well, and I'm from Haiti
You're from Haiti originally.
originally. But
Yes, very
live
good.
here.
Now, three of you have family in Port-au-Prince. You've talked to your families? Yes, they're okay? Go ahead, Marvinia.
Yes, I've spoken to my dad and the other family members. You just hear from people saying that they're okay.
You do. You don't have a chance to talk to them at all.
It's pretty hard to get communication-wise to actually get through to them.
It is. Cloudy, you have family there.
Yes, I have my wife and kids. They are now in St. Mark because after the earthquake, so they had to go away for a while.
And how far away is that?
It's a 1 hour drive.
It is. And that's where the rest of your family is?
Yeah, that's where they are.
It is. So they've gone up there and they're all together.
They're all together.
That's great. Farah, your family?
My family are in Port-au-Prince, so they're still up there. I spoke to them like 1 or 2 times.
You have, and they're all okay, as far as you know at the moment. And have you lost homes? Have you lost structures? Tell us a little bit about their experience. Go ahead, Farah.
Well, both sides of my family, my dad and my mom's family, their home is actually all destroyed. My dad's family, we also have other family in Archive, so they're there now. And my mom's family are in the streets, so
Same thing for me. I don't know. I'm not sure because we didn't really ask about how their house is, but everyone is on the streets anyway, so it's like they have no home, whether it's still standing, whether part of it is collapsed or the entire house is collapsed. Everyone is out on the street. Some of my family members are sleeping at camps or outside or in their cars.
They'd almost be afraid, I would think, to go back into a building even if it still stood.
Right.
Yeah.
And I think that's the recommendation from the Haitian government and the American government, anybody like the international government, not to go back inside.
It is.
The houses.
Claudia, your family, they're doing okay.
Actually, they lost their houses, but the main thing, they are alive, and that's the best I can ask for. So.
Well, and that's a relief for all of us. In Nate's blog, he talked about the fact that you all went to visit Claudia's village, town, city. How big a place is it? I don't know where your family lives. You don't know either, for sure. But
It's a very small town,
okay.
and this is where like the poor peasants they live, and usually back in the days they used to produce a lot like corn and plantain and all this kind of stuff. But lately with they don't really produce much, so basically everything's
It's just a very poor.
their living condition is
Yeah.
really, really bad, and that was like a big relief. Like when we go there, and then we were able to bring some meds, and they couldn't wait for something like that. And actually, they keep on asking when exactly we're coming back.
When can you come back?
Yeah,
Yeah.
exactly.
Yeah. One of the things Nate talked about was going to visit that village and visiting an orphanage. Now, we've heard quite a bit in the news about the effect of the earthquake on orphanages and children who are now, they're speeding up the process of bringing many of them to the United States. But talk to us about the experience, because you all went and spent a day doing medical care in an orphanage. Farah, what was your experience there?
I guess like growing up, I always knew, like I mentioned before, I always knew there's orphanage, but it was a very eye-opening to see how many children can be in needs and the wonderful work that people are doing. Even like, I guess like the whole experience in Haiti is teaching you like how you can do like much without nothing. So we went there, and then they were very happy to see us. Like, I guess just bringing a smile onto a kid's face for one day. I know it's not something very long, but it was very moving. So
It had a positive effect. I think I was just blown away by reading that there are 200 orphanages that are official orphanages and perhaps hundreds more orphanages in the country. How can so many children be familyless? Is this part of your experience growing up?
No, I mean for me, and going back to Haiti over the 2 weeks vacation, it was like a great eye opener for me, just because like it was my first time at the General Hospital, and it was my first time ever going to like an orphanage and seeing this, and I felt like so sheltered from everything when I actually lived there, and even my parents are very sheltered too. They don't know a lot of stuff, but going to the orphanages, like yes, there are 200 registered in Port-au-Prince alone, and
Oh gosh.
and Port-au-Prince alone, and there are other ones that aren't registered. And the ones that are up for adoptions are affiliated with a organization called Creche. So there are a lot of other orphanages that aren't affiliated with Creche. So those kids aren't going to get adopted. And someone is there to support, like give them food and bring them to school. But still, I felt like going to the orphanage, there were kids who were still in malnutrition. Like we had to admit a child because she was 6 years old and she looked like she was 6 months old.
Oh, that is
So-
just so sad. Claudia, you talked about how poor the region is where your family is from, and that's where this orphanage was that you went to visit. Was that something you were aware of before you went to visit?
Actually, the orphanages were more in Port-au-Prince.
They were.
I mean, that's like close to Saint Mark. That's where we went to.
Were you aware of the orphanages even in Port-au-Prince when you were?
Yeah, I was aware of it but no matter what, like we have those orphanages, but we have a lot more kids on the street. They're just on the street, that's where they live. That's what they get, whatever they can get to eat or anything like that. So basically, if we were to build orphanages, I don't know how many orphanages we would have to build because it's just really sad.
It is. It sounds amazing.
And I think another thing, in addition to that, a lot of like the kids I did see at the orphanage, a lot of them weren't like, it's not like they didn't have moms or dads, It's just like they weren't even able to feed their kids, so they just had to drop them off.
Oh, I see. So they're not necessarily not having parents. It
They're
was just a
not-
place for those children to live.
A lot of them are, they're not that they don't have parents or they don't have both, I don't know. But some of them do have parents, but they're not able to feed them or support them financially, so they're dropped off.
One of the things that was interesting to me was when you talked about the care that people were receiving. And in many cases, the care they needed to get was because they had developed some malady so far that specifically you talked about diabetes, Nate, and you said that people didn't know to take care of it early on. Claudia, tell us about care. How do people know to even seek care?
I think we're missing a big portion in terms of like public health. I think we're missing a lot of that in Haiti in terms of education wise.
Okay.
To teach them, like Claudia said before, the symptoms, what to expect and what to do if you do have symptoms. So I think we're missing a lot of that in terms.
So they just don't know to seek help?
And also, it's also like, how can you reach them? Some of them, they live like places where there's not even road. You have to walk there, like up the mountains and all this kind of stuff. There is no roads. There is no electricity. So how exactly do you reach them? So it's like the country is just that poor, and then we just can't really get to those people.
You
Even
can't
though you
teach them
may
because you
have-
can't reach them.
Yeah,
Yeah.
because let's say you may want to have like a radio show where you try to teach them, but they have no electricity. Then there is no way to reach them.
Very interesting. Farah, tell us about your experience growing up, the kinds of medical care you saw when you were a child versus what you would picture for them now.
I guess like growing up, like before my mother got sick, I guess I was in the same position as Ms. Vinya. I was very sheltered in terms of like the reality of Haiti. It's not until like she got sick and then it started to be like a little bit deteriorating. But like one thing one needs to remember, education or not, also in the healthcare, if I have 5 kids and I need to decide to feed them or spend $200 at the hospital, as long as I'm not dying, I'm gonna feed them instead.
Wow. You know
So-
what? That is a great place to stop. We have run out of time, but that really leaves us with a perfect sense of exactly what the situation is. And when we multiply that by the earthquake and the problems with the earthquake, I think you've all given us an excellent sense. Brian, Farah, Nate, Marvinia, Claudia, thank you so much for coming by this morning. I wish you all luck. I hope you get to return and help out even some more. I think you've given all of us a perspective we didn't have before. Thank you. This is Upstate's HealthLink on air on 570 WSYR.